When most people think about bladder problems, they think locally. They think there must be something structurally wrong with the bladder itself. Maybe it's an infection, maybe inflammation, damage, hormones, age, and sometimes that's true. But over the years, I started noticing something clinically that it was really hard to ignore. I would see patients come into our program with significant bladder symptoms: urinary urgency, frequency, pelvic tension, incomplete emptying, interstitial cystitis diagnoses, sometimes severe dysfunction. And what became interesting was that occasionally those symptoms would begin improving despite the fact that we weren't directly treating the bladder at all. I had one patient years ago who had to catheterize herself to urinate most of the time. Not occasionally, most of the time. So several months into the treatment, she told me almost casually during a follow-up that she rarely needed to catheterize anymore. I mean, that's a remarkable physiological change. And what's important is that we hadn't been doing bladder-specific therapy. We weren't directly treating urinary retention. We were working upstream: nervous system regulation, stress physiology balance, working on sleep, inflammation, nutrition, autonomic stabilization, recovery capacity. And more recently, I had another patient diagnosed with interstitial cystitis who had been relying pretty heavily on bladder installations to maintain some level of function and symptom control. And a few months into treatment, she started noticing she could go longer and longer between those procedures. And again, we weren't treating the bladder. So eventually, you have to ask yourself this bigger question: what if the bladder is not always the primary problem? What if, in some patients, the bladder is responding to a larger physiological environment that has become chronically dysregulated? And once you start looking through that lens, a lot of things begin making more sense. For example, most people already understand that stress can affect the gut. People feel nauseous under stress. They get stress diarrhea, or cramping, or reflux, or IBS. That connection is pretty widely accepted, but the bladder is also deeply connected to the stress physiology, especially the nervous system. So the bladder isn't just a storage container. It's a highly neurologically regulated organ that depends on constant communication between the brain, autonomic nervous system, spinal cord, pelvic floor musculature, immune system, and the local tissue, of course. Urination itself is actually incredibly coordinated as a neurological event. The bladder has to relax and contract appropriately. The pelvic floor has to coordinate. The nervous system has to perceive fullness accurately. And the brain has to interpret those signals correctly. Inflammatory signaling has to remain balanced. Muscles have to shift between guarding and relaxation appropriately. That's a huge amount of coordination that's happening automatically every single day. But when the stress response system becomes chronically dysregulated, that coordination can begin to break down. And this doesn't just affect signaling from the brain and the nervous system. Over time, chronic stress physiology can start changing the actual tissue environment in the bladder itself. The lining of the bladder, it's designed to function as a protective barrier. It helps shield the deeper tissues from irritation, but also it's interacting constantly with the immune system and the nervous system locally. And that lining, it's not passive tissue, it's biologically active. And just like we see in the gut with IBS and intestinal permeability, the bladder lining can become more irritated, more reactive, potentially more vulnerable when that physiology stays stuck in chronic stress chemistry for long periods of time. The circulation changes, inflammatory signaling changes, immune behavior, repair physiology. The bladder and the pelvic tissue can become living in more of a defensive environment. The pelvic floor itself can also become chronically guarded and hypertonic. And a lot of people don't realize that urination requires that relaxation and coordination, not just contraction. And if the nervous system is chronically braced and guarded and overactivated, pelvic musculature can stop coordinating normally. And that contributes to the urgency, incomplete emptying, pelvic pain, pressure, difficulty initiating urination, a sense that the bladder never fully relaxes. And there's an immune system side of this conversation too, which is pretty fascinating. The bladder has its own localized immune environment. The immune cells in the bladder wall, they're constantly monitoring for irritation, infection, tissue injury. When the nervous system and the immune system are chronically activated together, those immune responses can become amplified and more reactive over time. In some patients, mast cells and inflammatory signaling pathways appear to become increasingly sensitized. The bladder becomes more chemically reactive, more inflamed, more easily triggered. Even the behavior of the bacteria themselves can be influenced by that larger physiological environment. This is an area that's still evolving scientifically, but we know that bacteria do not behave the same way in all environments. So stress chemistry alters immune regulation, alters inflammation, alters the local tissue conditions, mucosal defenses. So the question becomes whether in some chronically dysregulated patients, the body becomes less capable of maintaining a healthy and resilient relationship with the microbes that naturally exist in those systems. And again, I want to be careful not to oversimplify this or reduce every bladder condition to stress. That's not what I'm saying. But I do think there's a growing recognition that the nervous system, immune system, endocrine system, inflammatory pathways, the microbiome, and the tissue repair systems, they are all deeply connected. And when the larger stress response physiology becomes chronically dysregulated, the bladder may become just one more system that expresses that imbalance. This is where I think a lot of people oversimplify the conversation. This is not simply anxiety. This is physiology. Chronic stress physiology changes immune behavior, muscle tension patterns, inflammation, autonomic balance, circulation, repair physiology, pain perception, even the threat detection pathways inside the brain and the nervous system. Over time, other systems can become more reactive, more defensive, more sensitive, the bladder included. In fact, many patients with chronic bladder issues, recurrent infections, etc., they also have the broader patterns that I commonly see with stress response dysfunction. They've got the sleep issues, fatigue, IBS and food sensitivities, chronic muscle tension, anxiety, brain fog, hormone issues, chronic pain, temperature dysregulation, burnout patterns, trauma histories. And at some point, you stop seeing the isolated organs and start seeing system-wide physiology. And that's important because if the physiology driving the problem is systemic, then treating only the local tissue is not going to fully solve the problem. Sometimes it helps. Sometimes it's necessary. Often medications and procedures are absolutely appropriate. But in some patients, unless the larger stress response physiology begins changing, the system remains stuck in that state, and it's hard to fully get ahead of those symptoms. So this is where concepts like central sensitization become important. The nervous system can essentially become overprotective. Signals that previously wouldn't have generated pain, urgency, pressure, irritation, spasm, begin generating exaggerated responses. The signals become amplified. That doesn't mean the symptoms are imagined. I'm not saying it's all in your head. The symptoms are real. The urgency, the pain, the inflammation, it's all real. The dysfunction is real. But the question is, what physiology is sustaining that pattern? And that's a very different conversation. I explain this to patients as the body is constantly adapting to the environment it believes it's living in, internally and externally. And if the nervous system perceives chronic threat, overload, exhaustion, inflammation, trauma, instability, sleep deprivation, metabolic stress, physiology begins shifting towards protection and survival rather than repair and resilience. And if that happens long enough, multiple systems in the body can begin behaving differently. We know the gut changes, immune system changes, hormones, energy production, pain processing. And in some patients, bladder physiology changes too. Again, I'm not suggesting that every bladder condition is caused by stress physiology. Structural disease, neurological disease, infection, autoimmune issues, these are important too. But I do think there's a subset of patients where the bladder becomes part of a larger pattern of nervous system and stress response dysregulation. Now, why this becomes encouraging is that when the physiology upstream begins stabilizing, often the downstream systems begin improving in ways that surprise both patients and practitioners. And that's the part I found fascinating clinically for years. The improvement isn't because we directly treated the bladder, but because the body has a remarkable capacity to heal once physiology begins shifting out of chronic defense mode and back towards regulation, recovery, and safety.